You were already famous by the people that you treat, such as Tony Robbins,
Chris Hemsworth, Zac Efron.
And then suddenly Kardashians.
Why are these big celebrities coming to this doctor? The doctors don't read, and they're just trying to make a business out of it. Regenerative medicine is really about cell therapy, gene therapy, and tissue engineering. So imagine if you could take all your cells in your body and press reset and just make them all like 20 years younger.
How much regeneration can happen to one system?
And I bet you would reverse aging like, I could see multi-decade. Dr. Khan, if you could make the best cellular therapy in the world and you had no limitations, what would it be?
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 19 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Today on Soberhead Podcast, I'm joined once again by Dr. Adil Khan, one of the most in-demand names in regenerative medicine. You've probably seen his work with Tony Robbins, Chris Hemsworth, Zac Efron, and even the Kardashians. But in this episode, we go far beyond the celebrity headlines. We talk about the real science behind his success, Muse stem cells, and how they are revolutionizing our knowledge of repair and regeneration, as well as stem cells. We explore his innovative vagus nerve reset using ultrasound-guided Muse cells, which I had my fair share, exosomes, and peptides to calm and reprogram the nervous system. Dr. Khan breaks down what's hype, what's real, and what's coming next, from trauma to aging. This conversation will definitely change how you think about regeneration. This episode of Soberhead Podcast is brought to you with the support of Gedik Foundation for Education. For over 30 years, Gedik Foundation has been providing opportunities for youngsters, children, and women to realize their dreams through scholarships, projects, and social work. And we're proud to be on this journey together. Investing in education is investment in the future. Subscribe and support us in our quest to bring you the most current scientific data and continue your access to the world-renowned experts in their fields as guests on Soberhead, with Turkish translation and completely free of charge. Comment on the episodes, like, and share. Dr. Adil Khan, welcome to Soberhead.
Yes, nice to be here.
It's second time around. This time is much comfortable, I guess,
yeah.
for you. Because
yeah, last time I was in Japan.
Welcome to Istanbul. You have a very specific purpose that you're here. We're going to talk about that too with my audience that watched our episode. We spoke about stem cells and Muse stem cells and exosomes. We will touch base a little bit on this podcast. But lately, you were already famous by the people that you treat, such as Tony Robbins. Tell me more.
Chris Hemsworth, Zac Efron.
Yeah, and then suddenly Kardashians, and then boom, it was viral on Instagram.
Yeah, it felt like it definitely went viral because I felt like so many media outlets picked it up, and then different, even in Asia, I know media outlets, and I think it just got a lot of people curious as to why are these big celebrities coming to this doctor? Mm-hmm. What's so special, right?
I'm going to start with that then, because Tony Robbins says for you, a brilliant practitioner, driven, hungry, and constantly searching for cutting-edge treatments.
Yes.
So I think that's why people are so after you and want to be treated by you.
Yeah, I mean, it's really humbling to hear that from someone like Tony, who I've looked up to for many years. And I think it's that curiosity of wanting to always learn and never stop challenging yourself. Because as a physician, I mean, as a psychologist too, it's easy to get comfortable and just be like, I know enough, I don't need to learn anymore. And for me, it was always a desire to want to improve my patients, right? That's kind of how I came across these new therapies.
So what's your training originally?
Well, I just did general medicine, like general practitioner, but then I did sports medicine, and then I did another couple years in interventional pain, so learning how to do injections. And then I started a clinical trial in Canada. I was one of the first to work in a clinical trial with stem cells for arthritis. Oh. But this was like the old stem cell technology, which aren't real stem cells as we can go into. And then that's kind of what led me down the whole stem cell pathway, because I started reading and being like, hey, there's real potential here. How come more people aren't talking about this? And then I kept learning, and that's how I came across the Muse cells eventually.
Yeah. With this podcast, my audience is very knowledgeable and they really are able to follow the cutting edge longevity treatments. But you have even more things that I didn't even hear. Let's start with these Muse cells, because on our last episode, it was just at the end, you kind of gave a little snip of Muse cell because it was over a year ago and you were excited that there's something like this and you just started playing with it, but you weren't so into it.
Yes.
Tell us more.
Yeah, exactly. I think that's a good point. I was just starting using it. Now I've had a lot of experience using it for hundreds of people. And so often, obviously, once you get that experience, you kind of see the results and what it can do for so many different people. And really, what a big leap forward it is from the previous technology. So I think people need to understand the history a little bit.
Sure.
So the history is very important, not to bore people, but the history of stem cells. This is a very brief history for people to understand. So Dr. Arnold Kaplan in 1992 first coined the term mesenchymal stem cells. Okay? And mesenchymal stem cells is an embryological term. We don't necessarily have to go into all the science behind it, but the point is these are mesenchymal stem cells that can be harvested from bone marrow, from fat, from umbilical cord. They're easy to harvest. So there was a lot of excitement that these stem cells can turn into new tissue and repair. But it turns out the research showed that these mesenchymal stem cells, or MSCs, didn't really do that. They only reduce inflammation. They could still be helpful, and then most of them wouldn't really survive. So Dr. Kaplan had a paper in 2017 where he said we need to rename them to medicinal signaling cells. So meaning they're just signaling molecules, they're not regenerative. But then you had all these stem cell clinics like in Panama, in Thailand, everywhere.
The one I went.
Yeah, Mexico, Turkey, wherever, Dubai, all over all these like places where there's less regulation. You have all these clinics saying we're a stem cell clinic, but they're not offering stem cells. They're offering signaling molecules, MSCs. And that's just a scientific fact. The guy who coined the term has said we need to rename it. But people, the doctors don't read. And they're just trying to make a business out of it. And so that's where the science was at. And because of that, a lot of mainstream doctors don't like stem cells because there's all these clinics that are just trying to make a lot of money off of it. And they're not really using them properly. And so that's kind of what led me down the road of trying to be like, okay, is there real stem cell technology out there? And that's where I came across, obviously, Yamanaka stem cells, right? Which is I induced pluripotent stem cell. And so I thought that's going to be the future. But the risk with those cells is that the risk of tumors and cancer. And there are some technologies out there where they can gene edit them to prevent that. But there's still a lot of gene editing. And there's still a lot of years of research, I think, before that's going to be safe for widespread clinical use. So then it was kind of like, okay, this is potentially the future that we're going to go into. And then, you know, funny enough, one of my patients told me about the Muse cells, and then I kind of started looking into it. And then I went to Japan and met with Professor Mari Jizawa, the one who discovered it, and I was kind of amazed because it was like, okay, Muse cells are basically a subpopulation of mesenchymal stem cells. So what that means is, if you take umbilical cord or fat, there's all these different stem cell populations, and one of them is Muse cells. So now you can use the technology just to isolate those. I always say it's like handpicking the best fruit. If you have a bunch of fruits and you want the best apple, this is like picking the best stem cell. The problem is you don't want to take all the stem cell population. You don't want to take all the umbilical cord stem cells. If you take umbilical cord stem cells or perinatal, like placental stem cells, there's actually like 10 different types of stem cells in there. So you want to isolate and standardize the cell population for the Muse cell because it has the best characteristics. And what are the best characteristics? Number one, they're pluripotent, which means it can turn into any cell in the body. Number two, it's non-tumorigenic, meaning there's no risk of cancer. Number three, it has a homing mechanism, which means you can do it IV, as I did today. And if you do it IV, it can actually go throughout your body and find the areas of damage and repair them. So you don't have to necessarily inject them directly into the organs, as has been shown in clinical trials for stroke. So it doesn't get stuck on your lungs. Exactly. Then that's the problem with mesenchymal stem cells. 99% get trapped in the lungs.
What's the difference?
Muse cells are smaller.
Oh.
So the size makes a difference. But then the cool thing about Muse cells is they also have mapped out their mechanism. And this is really what separates it from other pluripotent stem cells, because there are other pluripotent stem cells now coming out. Like there's trophoblast stem cells, there's fetal stem cells, there's other things that are coming out. But aside from the risk of tumors, the problem is those stem cells, they don't have the mechanism of clearly understanding how they're to integrate into the body, whereas Muse cells do. Muse cells eat. the damaged cell fragments. So they act like macrophages almost. So say if they go to the heart or the brain and there's old heart cells in there, they'll actually eat the heart cells and then use the cellular machinery to turn into a new heart cell, which now functions better. And then they go through a process of what's called epigenetic resetting, which is basically like, okay, because a lot of people get scared, right? They're like, okay, you're putting donor DNA in my body. Is the donor DNA going to express in my body?
Actually, I was going there with my questions before that you started.
I read your mind. So basically, the donor DNA is not being read because what the mu cell does is when it eats the damaged cell, then it uses the cellular machinery to essentially go through this resetting process to know what genes to turn on and what turn off. So it's essentially like now you have a cell that has less DNA damage, has new mitochondria, and can function better. And then is not expressing the donor genes.
Question. I did many podcasts actually, not just for stem cells, but I had the chance to talk about stem cells in between these podcasts, like Sandra Kaufman, Elizabeth Yurt, and so on and so forth. One thing that one of them told me that you have, I'm not talking about the exosomes, I'm talking about the stem cell part. One time you do fine, your body doesn't understand what's happening, so they would not react that something else came into my system. But if you keep doing an IV stem cell, then your system would say, there's something else coming into my body that is not mine, and it will kind of give a reaction as if it's an autoimmune.
Yeah, it could give an antibody. That's with mesenchymal stem cells. Because mesenchymal stem cells are not immunoprivileged. They're what's called immunoevasive. So they can evade your immune system for a period of time, which is why they can do their job, but eventually they get cleared out. And then that's how their immune system eventually processes them and then they're gone. But the mu cells, they are actually immunoprivileged, which is because there's two reasons. They have low expression of a certain HLA antigen, and then there's this other antigen called HLA-G, which basically, because it has a higher expression of that antigen, it basically means your immune system doesn't recognize it as something it needs to get rid of. And so your immune system doesn't form a response to it or a significant response. Now, to that point though, I do agree that if I was to design, if you were like, Dr. Khan, if you could make the best cellular therapy in the world and you had no limitations, what would it be? It wouldn't be allogeneic. It would be autologous, like if I could. But we don't have the technology yet, but I think there's something close, which is imagine if you could take the mu cell from your own body, because you have mu cell circulating in your own blood, and you could make that mu cell young again, back to a neonate state. And then you could use that neonate mu cell, that's your own DNA 100%, and then you can give yourself unlimited dosing without any concern at all. So that would be probably the best technology for cell therapy that I could think of, and that's something I'm actually potentially, trying to look into right now based off some cellular reprogramming technology that's available on the market. So I think that would be the ideal in terms of like not worrying about repeat dosing, because mu cells, to that point, like yes, we don't know, there aren't people out there who've had 100 doses of it, so we don't have enough long-term data.
But you agree with the other statement that I made, like other doctors weren't?
Yes, with MSCs more so.
Yeah,
with mu
for
cells,
MSCs, not for mu cell, for the old-fashioned stem cell. So you agree with that? Too many times that you do, so your body starts reacting.
Yeah,
that's not me.
Yeah, and they've done studies on this. I think I read for MSC something like 11 or 12% with just one infusion will form an antibody response. So then if you keep repeating it, then it just goes up, right?
Okay, let's now jump into something that I had today, and it's like swollen on this side. And we also spoke about that. Actually, I think back then you either were planning to do, because you explained to me that, there's this technology or this intervention, let's say. It was done, or you did it. Okay, now my memory is coming. You did in Canada to some soldiers
who
had PTSD.
Yeah.
And they were ready to be able to choose.
Yeah, they were suicidal. And then they was able to reset their...
Exactly.
It basically saved their life,
Yeah. And now, these days, it became a little bit more popular that people are doing. Let's talk about it. So what is it?
Think of it this way. The vagus nerve is a gateway to your relaxation system, but it also innervates so many different areas. Like it has innervations to your heart, your gut, your spleen, and so it can even control inflammation to a certain extent. It can control gut functions to a certain extent. For example, patients who have gastroparesis, which is like slow digestion process, that can be affected because of vagus nerve dysfunction. So you can imagine if your vagus nerve is dysfunctional, there's a lot of issues that you can have. Or if you have what's called dysautonomia, which your nervous system is out of balance. Like there's something called postural orthostatic tachycardic syndrome, POTS. POTS, that's a common thing not common, but something that a lot of people suffer with, and there's just no treatment for it. It's basically an imbalanced nervous system. So if you have an imbalanced nervous system, can we restore it, right? That's kind of the question that we're trying to ask ourselves with this intervention. So the way we're trying to restore it is by getting the vagus nerve to function better, and then getting that fight or flight response, which is kind of the other aspect of the nervous system, to downregulate. Because that fight or flight response, as I'm sure people who have anxiety or have dealt with that know, that sometimes it's just uncontrollable. It's physiological, right? You just go into it, and then your body's just kind of in that mode, and it's hard for your body to go out of it. And so what we do is we're basically doing a stellate ganglion block, which is a more traditional procedure, which lots of doctors have done. It's been around for a long time. But then the other component to it, which I've seen personally in my clinical experience, just helping a lot of people with this, is that when you inject the vagus nerve with the right substances, like regenerative substances, whether that's exosomes, stem cells, peptides, or a combination, then you can actually make the vagus nerve work better, and then you can actually restore nervous system function. And I've had patients with all those conditions where, like, POTS, PTSD, anxiety, gastroparesis. Like I've used it for so many different things. The success, it's not like the success rate is 100% for everyone, but definitely have had a lot of patients I've been able to help, and especially these are patients who really had no other options.
Vagus nerve, in a way, like it travels, like you said, it's the between the gut to the brain.
Yeah, it's like a highway.
Yeah, it's a highway. So it has an effect on the gut, yet it has a huge effect on the brain.
Yes.
What did you injected today to me?
Yes, we injected the Muse stem cells, Muse exosomes, and BPC and TB4 peptides.
Oh, wow. I didn't know. Okay, great.
Which are more just, as you know, probably like healing, supportive for regeneration. And we injected those directly into the vagus nerve. We use an ultrasound, right? Those guided. And then into the stellate ganglion, we just injected anesthetic, which is a more traditional thing. Yeah.
So with both, how long it takes the person to see the effects?
So typically the results with the stellate block, I mean, that can be sometimes immediate. I guess in your case, that was your sister. She had the block. You didn't have the block. You just had the vagus nerve. So when you have the block, sometimes people can feel it within a few days or a few weeks. If it's just a vagus nerve, that's more of a reprogramming effect. So that can sometimes take a month or two because it's a slower process because, you're restoring function. So, yeah.
I think it's very important because here's the thing. In this world, and especially I have so many, I have a podcast, I see clients, I have few businesses that I run. So I'm working almost, I don't work while I'm sleeping, but I go to bed sometimes like, I shouldn't forget about this tomorrow.
Yeah, right, yeah.
And, yes, there are techniques, meditation, you take a walk, ground yourself, whatever. But sometimes you really need, more strong intervention to make this reset, to regenerate the whole system.
Yeah, and that's exactly what it is. It's a reset for your nervous system. And that's what a lot of people need in modern society because I think a lot of people can resonate with the idea that their body goes into that fight or flight too easily because of stress, right? And so this just builds stress resiliency. And we've had clinical cases where we were able to even see their cortisol regulation become normal after this procedure, or their HRV improves after the procedure. Wow. So we have biomarkers that you can use to track the efficacy of the procedure as well.
So the ultrasound is important, I think, for the vagus nerve because I saw like it really goes deep in your throat.
We're right across it, right in front.
Because I know that in Turkey they do often the neural therapy, and I think it's more to the surface with the program.
Yeah, exactly. Yeah, neural therapy is superficial. Yeah.
Okay. So let's now come to, since we covered the Muse cells, the vagus stem and stuff, what's coming to us?
There's so much stuff. I mean, regenerative medicine, just to remind people, is the idea that we're trying to restore the right signals and to your body's blueprint to heal itself, right? Your body has a blueprint on healing and regeneration. And now we're just uncovering what that is. As more data comes out and more science comes out, the perfect example is this recent study where they did with like, it wasn't in humans, but it was in this animal called the exaltal. And it's basically like this like little lizard thing. And then essentially you could just give it like a very specific growth factor. Like they found like the right molecule to give it, and they was able to like regenerate its limb. Like it's pretty crazy that just basically the point is we don't know exactly what all the signals yet and all the kind of right, machinery that we need to activate to get your body to heal, but we're learning what that is. And every year is going to just get it more and more. And so regenerative medicine is really about cell therapy, gene therapy, and tissue engineering, right? Those are like the three kind of, let's say, pillars of it. And so in each of those domains, there's so much advancement happening. So we obviously talked about the mu cells, but there's a lot of advancements, like we touched on a little bit, was like cellular reprogramming.
Yeah.
So cellular reprogramming just means pressing the reset button on a cell. So imagine if you could take your body, all your cells in your body and press reset and just make them all like 20 years younger. So that's what Retro Science is, and also labs, which are these big companies funded by big people like Jeff Bezos and Sam Altman, are working on. But then there are companies that people haven't heard of. For example, there's a group in China that I was just there that they figured out how to do partial reprogramming. So for example...
Okay, tell me about that, because you said, is this the...
Prelox? That's another Chinese thing. Chinese people are working on so much stuff.
Prelox,
That's
okay.
different. Yeah. So this is actually just a small molecule. I don't know exactly what the molecule is because it's a patented process, but basically the small molecule can take a skin cell, so like a fibroblast, and then it can basically make it go back into a neonate state, but not all the way back into embryonic. So that's the key difference, because the problem with Yamanaka stem cells is that they go back to embryonic, and then if they go back to embryonic, you have the risk of tumors and cancer. But if you can just do partial reprogramming, where you can take it back into a baby-like state, you don't have the risk of tumors because it's not quite embryonic. So that's what these Chinese scientists have figured out. So partial reprogramming, which I think is a huge breakthrough, really. Right now, it can only be applied to fibroblasts, but eventually, we might be able to apply it to other cell lines as well.
Like you were saying, like to the mu cells.
Yes, exactly. That's my dream, and that's exactly what I want to do.
So let's give an imagination to people who are listening to us. What would happen if they would take a piece of a skin or the mu cell on me, and then they make it back to... Well, like 5 years old, 10 years
exactly.
old?
Like when you're
and they inject back that to you, whether IV or organ by organ. How much regeneration can happen to one system?
Well, look, I think we had a good study. There was a study that was just, I don't know if you saw that study published a couple months ago on monkeys, primates, on reversing aging using senescent resistant cells. So these were gene-edited cells that they basically inserted this gene called FOXO3, which basically makes the cells resistant to senescence, meaning dying or becoming into zombie cells. And they gave them every other week for like a year. And this significantly reversed the aging process throughout the whole body and multiple organ systems in the monkeys. So that shows the possibility of what these cell therapies can do. And if you had that young mu cell that was naturally, especially if it was a match to your own DNA, which can integrate very easily into your body. And again, we have a mechanism on how the mu cells integrate, right? They eat the damaged cells. So they have a mechanism that's clear on how they can actually regenerate and repair new tissue. So theoretically, and this hasn't been done yet, but this is something I want to potentially do in the next year, is imagine if you could infuse yourself like every other week for a year with mu cells, and then and I bet you would reverse aging like I could see multi-decade, because we have results with even people with just data that we're getting back with even just an infusion every 6 months or a year, they're reversing their biological aging by 10 years and in multiple organ systems.
So let me jump into this biological age thing. I had Oliver Zollman here.
Yeah.
And, the British doctor.
Yes, yeah. The accuracy of them is...
We chatted with him, and he has this algorithm that he measures 81 organ to understand what's young, what's not young. And actually, let me do a bit of a gossip, that I asked him straightforward. I said, so I didn't give Brian Johnson's name, but I said, does it really work like this guy or someone, whomever, me, you, like you live horribly for 38 years.
Yeah.
And then suddenly for 2 years, you do some like laser treatment or whatever, shock waves, and not much, actually. The most progressive thing he did, I guess, it was the follistatin gene therapy, which we will come to that. And then suddenly you're like 15 years old on your penis, and then whatever, like 20 years old on your skin.
Yeah.
And he says, no, and it's not happening. Yeah. So you live in this. You go to China, which is the most, I think, in my opinion, technologically advanced place.
Yeah.
Probably they would laugh to someone saying like, oh, I do workout and I do fasting and go to bed at like 8 p.m. and I am younger like 40 years.
Yeah. No, it's, I agree with Oliver. I think there is some predictability to it. Like obviously there's been data showing that these epigenetic clocks can predict mortality to a certain extent, meaning that they can predict, how long you'll live. But by you reversing the aging process on paper, does that necessarily mean you're going to live that much longer? No, I don't think it does biologically. But what I think can be a more important indicator is the rate of aging. So I think that can be a useful, measurement tool. And biological noise, which is the one I like to use, is called Generation Lab.
Yeah.
And that one seems, biological noise, and it tells you your speed of aging. I think that can be used as a decent metric, and especially looking at your immune system. So the reason I don't, you can look at 81, organ systems, I guess, but I think you have to also look at what's going to be the best predictor of aging. It's immune system health. So we know this because not only all the data on basic science is coming out, but there's this study done at Stanford, which was like a 17-year-long study where they looked at different biomarkers of aging, and they found that basically immune system health could outpredict any epigenetic clock by up to 7 years on predicting like how long people are going to live. So, and we know, so that's why to me, what I look at is why immune system? Because immunosenescence is essentially when your immune system stops surveillance and doesn't do its job anymore. And that's what leads to chronic inflammation. That's what leads to damage. And that's what leads to more damage basically happening than repair. So if we can slow down your immune system aging, I do think you're having a real impact on someone's trajectory of how they're going to age, which these tests can measure. But then I think ideally, and this is based off scientists I've talked to, I think ideally you would measure and use an epigenetic clock and then use some sort of proteomics as well. So for example, proteomics is looking at all the proteins in the body. And so there's like a technology, for example, called SomaScan. And then there's other ones being developed too, like Protein Age. And essentially, if you combine that with the epigenetic clocks, that can give you a really whole picture of how someone's body's aging and how they're responding to longevity treatments.
I was chatting with Dr. Yurt, and she says that, she exactly said the same thing. I said, what do you think, which organ is the most important? And I was expecting maybe the brain. She said the immune system.
Nice. She knows what she's talking about.
Yeah, of course. No, she's, she's considered the GOAT of the regenerative medicine in the medicine part, not like doing the
injections. Yeah,
but she's an orthopedic surgeon.
Oh, okay, but she's just a scientist.
Yeah. So she said the minute that your immune system start failing, then your system is not going to be functioning the way it should.
And that's why when you're talking about what's on the horizon, there was a study done earlier this year showing it was in mice, but they basically use what are called engineered hematopoietic stem cells. So
engineered what?
Hematopoietic stem cells, HSCs.
What is that?
Which are like they're the stem cells in your bone marrow that basically give eventually turn into blood cells and stuff like that. And so they were able to create these engineered cells that were able to basically rejuvenate your bone marrow. And so if you could rejuvenate your bone marrow, then you could have an infinite source of young stem cells that are being created, which are creating lymphocytes and your immune cells and your blood cells. So I think bone marrow microenvironment rejuvenation is another area in the future that you're going to see in combination with thymus regeneration. Because thymus gland is a little organ that sits here, and over time it shrinks. And as it shrinks, your T regulatory cells, which are important for regulating your immune system, don't work as well. And then that's what leads to autoimmunity and all these other things with aging. And so if you can kind of let's say, rejuvenate those two big sources, then I think you're going to put a big dent in the aging process.
So when do you think, let's start with the cellular reprogramming, when do you think that would start being more available for people to you?
Well, the partial reprogramming, I mean, we're planning to bring that to our clinics probably next year. Yeah. And that'll be available in in Mexico and Florida, even in Florida, and then even Dubai. Yeah. So this is the group in China that I checked out. And the reason is because the mechanism is different from the mu cells. So I do think they can work synergistically anyway, because they work slightly differently.
So that's amazing.
So they take a skin, just to give people an idea of what that looks like, is they take a skin biopsy from behind your ear, and then it takes 3 months to reprogram the cells and culture them. But then you have unlimited doses from that. Like you're talking, like you can just come in every couple months and just do an infusion of your own cells that are young.
I think they're currently doing it, not the reprogramming part, but they're able to do your own stem cells with the skin biopsy.
Yeah, there's people doing that now, but they don't have that. Yeah, the reprogramming part is the nice add-on.
Yeah, of course it is great.
Yeah.
I mean, they did it to me actually for my face, and I'm like, with my age, I mean, how much?
Like, do you really want your stem cells?
I mean, I kind of don't.
Yeah.
I'm going to be turning 54 like next week, and I prefer younger ones.
Yes.
Or getting younger. So what else coming besides this?
So I think the other big thing is the precision gene editing. So that was a Crelox system thing that you were mentioning earlier.
Crelox.
Yes, that was basically, I'm sure most people have heard of CRISPR because it's a popular gene editing tool. But the problem with CRISPR is off-site targets, meaning it's like, it's like taking a pair of scissors, you cut like the DNA base pairs, and then they repair themselves, but sometimes there can be off-site targets that get affected too in the repair process. And it
seems like it can continue generations.
Yes. Yeah. So basically, there's technology now like this one in China again, where they were able to use this very specific gene editing tool I would say it's like a Google Doc almost, right? Where it's like they can edit the exact letters and they can rewrite it and flip it and do whatever they want. And it does exactly what they want it to do. And the cool thing is, the issue before too was sometimes you would do these gene edits and then they would like unwind, like they would go back to the way they were. But then with this new system, you don't have that risk either. There's also something called prime gene editing, which I'm not an expert on, but I do know that the prime gene editing is also an advancement from CRISPR, meaning it's more precise. So the point is there's more advancements happening in gene editing than just CRISPR, right? CRISPR, I think, was the one that everyone thought was going to be the holy grail and fix everything, cure every disease again. But it just wasn't precise enough. And so I think Crelox and prime gene editing have much more potential for being that holy grail, because then you're really talking about doing amazing things where it's like, okay, you can take cells that are getting older and turn off and turn on certain genes and really reverse the body. But as we talked about today, there are companies such as Triple Helix, which are doing that in the real world, where they have very well-studied gene therapies and that have viral vectors, which have been studied for decades, and they're using them in patients. It's not, and they're able to actually show reversal of aging and show increased muscle strength.
Patrick Sewell was my guest, and it seems like it kind of is like how you described, like they don't know how long it stays. They think like a decade to 2, but it's not like until you're dead.
Yeah. So it's not like obviously having a gene editing system like those ones would be the best, because then it's like you have a permanent.
Again, Chinese.
Yeah, exactly. So, but I think I still think there's something to those gene therapies. I just think the vector in which you're using it is really what determines their efficacy, right? Because there's like mini circle plasmids.
Yeah, let's come to that, because it seems like you're changing your mind a little bit from mini circle plasmids to the AV vector.
Yeah, as a doctor, my job's to try to bring my patients the best technologies and the safest and potential and most effective, right? And so mini circle plasmids, I think, are relatively safe. I mean, Dr. Sewell may disagree a bit because he said sometimes maybe they might migrate to other places, and that might be true. But for the most part, they seem safe in my experience and from what I know. But their efficacy is really mixed. So I could say that the results are very inconsistent, and I think that's because people's own body shuts off the plasmid and it just stops expressing. And I think that happens to a lot of people after a couple of weeks or a couple of months, and we just don't know how long it lasts. And there are some people I've had who've had amazing results, but that's probably 10%, So
what do you mean by amazing results?
Like they put on 4 or 5 kgs of muscle, they put on 10, 15% strength. So they're getting significantly stronger and they have more muscle.
I have to share my experience. I did it.
Yeah.
I did it before a surgery, and I knew I wasn't going to be able to work out, so I didn't want to kind of lose all my muscles.
Yeah.
And I couldn't work out in the first, like, you know, normally they say like you have to really do work out the first 2 months and that you will get the most effect. I couldn't work out the first 2 months. But the result was pretty good because I didn't lose my muscles.
Yeah.
I did lose my strength because I wasn't able to do much strength.
Did you find you were able to regain your strength quicker than you would have without maybe
I may probably, because imagine like, you know, with my age and as a woman, not being able to do any strength training for 3 months is a real thing.
Yeah.
It didn't take me too long to pick up my pace.
Right. Yeah. So, I mean, I think there are certain applications such as that where it can be useful. It is an expensive treatment though. And that's where I think the problem is too. It's something like with what they have shouldn't be that expensive just based off knowing how inexpensive plasmids are and stuff like that. This should be much cheaper.
Sure.
But anyway.
But also, you know, it's important when you're at a certain age, you know, when you lose your muscle at the age of 54 almost, it's very difficult to put it back because I'm pretty muscly.
Yeah, you are. I saw it today. Your veins were popping out.
But, you know, it's important. It's a, you know, it's a longevity organ.
Well, I think the viral gene therapy, the follistatin, especially the one, you know, again, it's quite expensive, but that one, it seems like people put on significant muscle consistently, whereas the mini circle is inconsistent. That's what I would.
The thing is, though, with the person who did it, not me, Patrick Sewell, after a shoulder injury, he couldn't work out and he lost all.
Yeah,
I mean,
you have to keep on.
Yeah, you have to keep doing it.
Stimulating the muscle.
I cannot wrap my mind around how it's going to help sarcopenia. Because the old person already, they do not have a muscle. They don't have the strength. They may have a little more after you do the gene treatment. But
well, I mean, there is research where even people in their like late 80s or early 90s, if you start them on resistance training programs, they're able to put on strength and muscle. So, but that's because they haven't trained before. So I think it's the same principle in that if you take the gene therapy and you start doing progressive training, then you'll be able to put on muscle even at an older age.
Like, you know, it's interesting. Like everything in life, nothing is for free.
Meaning,
like you have to do the work.
It's not magic. I mean, at least not yet. Maybe one day when we have this Krelok system in humans and where you can just gene edit to get your body to become muscular as possible, then who knows? Yeah.
Tell a little bit about, you know, your specialty, because it seems like there's a German cell growth.
Yeah, the for cartilage.
Because, you know, many people are struggling with osteoarthritis and pain and joint pain, you know.
Yeah, so this was actually, it's funny because that post went viral where it was like this German technology to regenerate cartilage. But that technology was actually from 2013. Oh, wow. And it's just for focal cartilage defects, which isn't the case in osteoarthritis. Osteoarthritis, the cartilage is affected in the whole joint, and it's like thinning of all the and you get that bone on bone, so to speak. So that chondro filler can still have an effect surgically for filling a small defect because it basically creates a scaffold, and then your own stem cells come in and they can repair the area. But the currently what we have available is we can combine pluripotent stem cells. And remember, pluripotent just means they can turn into any cell, including cartilage. And we can combine that with the hydrogel scaffold. So, and the hydrogel scaffold is basically a 3D cushion. So imagine, you know, fillers, right? Obviously, hyaluronic acid.
Sure.
So this is like a filler, but then it doesn't stay as a liquid. When it comes in contact with the synovial fluid in the joint, it forms like a scaffold, which is like a little jello-like substance, you know, it just encapsulates the cells and then creates a mechanical cushion. So then the cells can slowly release. So it acts like a drug delivery system for the cells. And then it also allows the cells to actually regenerate and turn into new cartilage. So you can actually regrow new cartilage, as we've seen in some of our patients anecdotally. And then right now there's a clinical trial that's just been started with the MuCells for assessing cartilage regeneration. So we'll see, obviously, after that clinical trial is done too. So if we have a controlled study to show it, but I can say based off my results I've seen with patients, we are seeing that. But the future of this cartilage regeneration of our specialty is really, I think, going to be 3D bioprinted customized scaffolds. So there's a company, so there's a company called Cytex Ortho out of Washington University, and basically, or University of Washington, and basically what they do is they get images of your knee, for example, and then they'll create a customized scaffold for it, and they can implant it arthroscopically, and then you could seed it with cells like mu cells or stem, pluripotent stem cells, and then you can actually resurface and regrow a new knee, basically. And they're already doing that with hips. They've already done it in animal studies, and they're starting their clinical trial in humans this year, I believe.
I think you're seeing a majority of time people who are having joint issues, I guess.
That's probably 50%, and then 20% is like longevity and cosmetics, and then the rest of 20-30% is chronic diseases like autoimmune conditions.
Yeah, I want to come to that because I took a note. You spoke in one of your talks about the MS treatment.
I just had a patient 2 days ago we followed up with who's in remission from MS, which was honestly, it's hard to believe. My colleague was like, "You should win a Nobel Prize." I was like, "I don't know about that," but I mean, but I do know that we can help these people pretty consistently now with the protocols we have, and that's
what is that
because look, MS. There's been research on this. It's linked to EBV, right?
What is EBV?
Epstein-Barr virus, chronic infections. I think 85% of cases, but then there's been other studies showing almost 100. Like it's just, let's just say a very high percentage of autoimmune conditions are linked to chronic infections. And these chronic infections, again, this comes back to immunosenescence. Your immune system isn't working as well. And why isn't it working as well? Is because these chronic infections, these toxins, microplastics, all these things build up in our bodies, and our body's immune system gets hijacked, basically. It gets distracted, it can't work as well, it has to deal with all this other stuff, and then it allows those infections to overtake and start causing damage. And then your immune system starts going haywire, and it starts attacking itself. So that's really what we think it's called molecular mimicry. So we really think that's one of the biggest drivers as to why people develop these conditions. So if that is, then this is where the concept of subtractive medicine comes in, which is where we need to remove the bad stuff. That's what subtractive medicine is all about. And again, the technology has only gotten really good in the last couple of years where we can remove the bad stuff and keep in the good stuff.
With which technologies?
The subtractive medicine technology.
Okay.
So
no, I understand that, but what
so
surgery?
It's like a dialysis type of thing. So there's one called in-use-pheresis. There's one called Clarify, which is the one we're getting in Dubai, and then we use in-use-pheresis right now, which has been well studied and used for many years too. And basically, these devices have these special filters that kind of scrub your plasma and trap these inflammatory cytokines from these chronic infections, and they lower the toxic burden in your body. And then you can combine that with the mu cells to kind of reset your immune system. So it's like, think of it like an immune system reset. And once your immune system becomes resetted, then it can start functioning better.
You said a couple of things when we were together earlier today about EBO and plasmapheresis, that which parts you don't like about it?
Well, I think the reason I'm not a huge fan of TPE, like therapeutic plasma exchange, because there's studies showing that it might actually increase microplastics in the body because of the tubing and because of the way it's done. And then the other thing too is that the results seem to be transitory. So meaning people feel like there's a anti-aging effect and some benefits, but it seems to last only a couple weeks. And then the effect wears off afterwards. And then EBO, which is like ozone dialysis, I think that's not bad. It's just not as effective as these other ones. So meaning it's all, and again, these other ones are also more expensive. So some people may just be like, okay, I can only have $1,000 to spend, then maybe EBO makes the most sense, right? Because that's cheaper.
But like plasmapheresis is not cheap.
No, plasmapheresis is not cheap. So, but if I was to say like, the order, it'd be like EBO, TPE, in-use-pheresis, and Clarify up here. You know what I mean? Like that would be my order.
Is in-use-pheresis is like they heat the blood and...
No, that's HHOT.
Oh, okay.
So that's that one is in Vienna, which is hyperthermia, hypoperfusion, oxygen therapy. So basically it's like it's a way they're trying to heat your blood because they're trying to get those chronic infections to move outside from intracellular into the blood, and then your body, and then they can trap them and remove them. But there are some risks with that. So I think that's definitely not for longevity purposes, but for people who have chronic illnesses, that might be a good option.
How do you say it?
In-use-pheresis.
In-use-pheresis. How does that work?
It's just
the same way.
It's just like you sit there for 2 hours.
So the two the Cleary and the other one.
Yes, they work the same. Yeah, it's just a filter that's different. The filter of the Cleary is from my understanding, is a bit better, and it does what's called centrifugal apheresis, so more plasma goes through it, whereas with the iniusphoresis, not as much. So you may just have to do more sessions of the iniusphoresis to equal the same thing as the clary. So clary we typically only have to do once, but iniusphoresis you have to do at least 2 times.
It's interesting. When we spoke the last time, you said that I asked you if you do any of these, and you said like most people who are coming to me already comes after doing all these procedures. So
Yes.
all I do is the cells.
Yes. But
Now you're making everything under one roof.
Yeah, because I realize it's too inconsistent. People go all over the place for different things, and I'm just like, it's better if we just have it ourselves. Yeah.
Yeah. So is there anything new else coming into the regenerative field?
Well, okay, new, and what's going to be new is, so we talked about nervous system reset, right? We talked about immune system reset, and then the other reset that we're working on and we're doing now is the gut reset.
Okay.
So the gut reset, because again, your gut is so important to your immune system. So there's a doctor, Sabine Hazan, who's amazing. You should bring her on the podcast one day, because if she is ever in Turkey, but she's like the queen of FMT, fecal microbial transplant. Based off her research, she's found that there's certain microorganisms that if you increase their levels, they can protect you from disease or even reverse disease. So she's been able to treat cases like autism, like autoimmune conditions, even cancer, just by giving them the right microbes. And so obviously it is a more invasive way because you have to do it through colonoscopy, but there is now a reasonable way for longevity, because we know gut dysbiosis is one of the hallmarks of aging, right? But you're not doing fecal, it's just microorganisms.
Okay.
So the name needs to change, but it is what it is. But but so what we have now is if you do a gut test and you send me your results, I can match you a donor and I can get you pills that are freeze-dried, and you just take them for 10 days, and they can help to repopulate your gut. So it's just like a next generation probiotics.
Instead of, that's so great.
Because probiotics don't really, they're transitory.
And you take like every day, all day long.
Yeah. This is just a course. Yeah. So that's something, and then you could do before and after testing to see that your gut microbiome actually changed. Yeah.
So it is there?
It's available now. Yeah, we could do it. Like if people want to do it with us, we can do it for them. Yeah.
So how do you do, so donor meaning whomever collected already from people?
Yeah, we have like a database, our manufacturer that we work with, who has a database that based off the microorganisms that you're missing, they're able to give you the right match, or depending on the condition or disease you have.
Yeah, the gut is really important.
It's so important. The gut, I'm sure people have heard gut-brain axis, but there's gut pancreas, gut liver, gut everything, gut knee, gut joint axis. The gut communicates with every organ. So if the gut isn't...
I think that's one of the most important things that we shared on this podcast, because it's interesting, like everything went to focus to the gut, the brain, like you said, the lung, any organ actually. Now you're saying the knee and the joints.
Yeah, exactly. So if we can restore the gut lining, which the stem cells can help with, and then we can repopulate the gut with the microorganisms, which the FMT can, then we can really start restoring health and helping people with these chronic illnesses, which is what we're seeing. Are
you going to be doing all these only in Dubai?
Most of them are available in Dubai. No, but we have them in Mexico and then Florida as well. And yeah, so it's good to have it available in the US now, because I think a lot of people before had to travel for these therapies. So
Adil, last time also we spoke, you had a place in Serbia?
Lithuania. Yeah. So we still have a clinic. I mean, we have a clinic. It's not our clinic. We just partner with one there. I just go there, a couple times a year.
I think Japan and Lithuania was focusing on cancer treatment.
Yes. Yeah, exactly. So cancer is, that's a whole other discussion. But the point is, there's so many advancements happening outside of chemo and drugs. And there's a lot of people in Japan. I've found some groups there that have been doing immunotherapy for decades, and they basically can train your immune cells to target the cancer. So, it's pretty amazing stuff.
So what are you guys doing?
For cancer? I typically work with that clinic, so I don't treat them myself, but what they do is they use so for example, they'll take your T cells, your dendritic cells, which are like immune cells in your body that help to fight the cancer cells, and they'll basically go through a process of let's say training or education so that they can target the cancer in your body. And then they'll just reinfuse them. And then you go every 2 weeks for an infusion or something like that.
How much is the price difference between the regular old-fashioned, the new name? What's the new name of the stem cells?
Medicinal signaling cells.
Medicinal signaling cell to Muse stem cells. Like
It's a leap forward. It's not like 2 times better. It would be like an order of magnitude better, like 10 times better. You know what I mean? So that's the thing. It is a very significant leap forward, and that's why if you're not a regenerative medicine doctor or if you're not in this field, you wouldn't think that this field has progressed so much because you think that people are still using MSCs, but and which most doctors are still using, but Muse cells are just so much better. Yeah.
Yeah. And you use like how many millions?
Well, the clinical trials that were done, they only use like 15 to 20 million IV.
Oh.
So
not like the other ones used to be like
100, 200 more. Yeah, exactly. So it does depend on your weight to a certain extent, but we can, if I'm doing a knee injection or something like that, I might just use 10 million and that's plenty of cells, And then if you're doing an IV, you can use as low as 20, but if you want a higher dose, you could use 40 to 60. Some people may do higher than that, but you really don't need to.
Do you usually mix it with the exosomes as well?
Yeah, the reason we mix it with exosomes is because exosomes, as people probably know, they're like the soup that the stem cells grow in, right? And they have all the nutrients and signaling molecules to create a more favorable microenvironment for the cells to do their job more effectively. So for example, if there's a lot of oxidative stress and a lot of senescence, then the Muse cells can't integrate as easily. So the exosomes can kind of help with that process.
In Turkey now, we're going to be, I think Only Health, a partnership with Only Health, they're going to be manufacturing Muse cells.
Yes, we're in the process of setting that up here so that there will be a local manufacturer as well for the Muse cells, yeah.
And it's going to be the same technology because in Turkey, Only Health is a dear friend and we help each other a lot. And in Turkey, we have this problem. We never trust when something starts and comes to Turkey and starts being manufactured in Turkey. We don't believe into it. So like when it comes from outside, it's always better than what we do in here. So what he told me that there's a certain way of manufacturing. There's a patented way.
Yeah. That's why we call it the Dezawa Muse cells. So meaning it's named as to honor her name, but basically to say that, because there are other Muse cells out there. There's different
there are?
Yeah, there's people making Muse cells in other clinics, but they're kind of like rip-off Muse cells. They're not the ones that are studied in the clinical trials, so they're not clinically validated. They may not have the same safety profile, so we can't really vouch for them the same way we can for Dezawa Muse cells. And that's the reason why there's a technology tech transfer and this licensing and making sure that the people in Turkey are making it to the same standard as a Japanese lab would be. And that there's obviously checks and balances to make sure that's the case.
Yeah, we just went very quickly over this MS thing. How do you treat MS?
So yeah, we were talking about how...
and then we jumped to other stuff.
Yeah,
because there are many people that I know who has MS, and I have lots of people reach out to me through my audience.
Yeah, it's a pretty devastating diagnosis, and the conventional treatments don't get to the root cause. Like we said, the root cause is chronic infections. So what we need to do is we need to get your body to deal with the chronic infection. And the way we do that is by rebalancing your immune system. So how do we rebalance your immune system? We need to do the subtractive medicine. We need to remove the bad. So we do that. And then we need to get your immune system to work better. So how do we get your immune system to work better? Infusion of Muse cells, because that helps to restore rebalancing of your immune system. So, and then you can also inject them potentially intrathecal, which is directly into the spinal cord to help with the lesions and then you can also do intranasal injections as well. So that's kind of the combination.
To the brain?
Yeah, because it goes to the olfactory bulb and that way it goes to the brain. And then you can nebulize exosomes as well. So that's kind of like the general protocol that we do for it.
Why to the spinal cord?
Then because they can go to the brain that way too, right?
Oh.
Yeah.
Oh, the goal is to reach.
Yeah, because people have lesions obviously in their brain, usually or spinal cord. Yeah.
You had treated
from it, which is pretty, I know, hard to believe, but it's
Like how far in they were, and they're in remission now?
So I mean, the one was she was like full out MS, but she wasn't like wheelchair bound. But she was like, I'd say mild to moderate. Let's say that in terms of like severity. Yeah.
It seems like it's a very interesting disease. It just have an attack and then waits for another sometimes 20 years.
Yeah.
And people become very lazy.
Right,
They
exactly.
think that, oh, it was just
It's like cancer. You have to remain vigilant.
Yeah, it seems
and you have
like.
to do what you can on your own to maintain your immune system health.
Adil, anything else you want to share?
The only thing I'd like to share is to remind people that your body has this blueprint to heal itself, and we're now figuring out what that blueprint is. So this is only the beginning of regenerative medicine, and in the next 5 to 10 years, it's just going to keep evolving.
And Dubai is your main kind of like it's very close to Turkey, and many people live there now. So you treat people.
Yes, we have a clinic in Dubai full time, and I'm there, living there right now.
All right.
Yeah.
And for people to know, with your other doctors, when someone comes, you treat with them.
Yes.
You don't just like
Yes.
the face, but you're not there.
Yeah, I'm there supporting my other doctors, but my other doctors are generally, obviously I can't be everywhere at once,
Sure,
and I
of
want
course.
to, my other doctors are usually the ones doing the treatment, but I'll be there to at least be there or guide
Yeah.
the patient and make sure, yeah.
Thank you very much for coming here.
Yes,
that
thanks
was
for
great.
having me.
And thank you for poking my
Yes, yes.
neck, but
Yes.
I'm sure my nervous system is going to be much better thanks to you.
Yes, thank you.